Hello, my name is Joan Vande Krol Zylstra, and I am a registered nurse and currently work in the education department at Pella Regional Health Center. This April, I am celebrating 50 years of working here at Pella. In September of 1966, I graduated from the School of Nursing at Blodgett Hospital in Grand Rapids, Michigan, and also attended Calvin College at that time. And in October of 1967, I walked for the first time ever into Pella Community Hospital, as it was known then, to apply for a position. I interviewed for that position with John Harmling, who was the administrator, and he hired me on the spot. We did not have an HR department. Managers and the administrator did the hiring. My first position at Pella was as Assistant Director of Nursing. Gladys Boyer, she was an RN, but she was also an anesthetist, and she was the Director of Nursing. And she needed someone to cover for her when she was in surgery. I had just worked for 3 months as a head nurse on a medical surgical unit, and which included responsibility for scheduling and staffing. That also became my major responsibility at Pella. Since that time, I've held many positions at Pella Regional. I've worked as a staff nurse, on med-surg, OB, and even scrubbed in surgery. At Blodgett, we spent 3-month rotations on med-surg, OB, pediatrics, surgery, intensive care unit, and psych. And these areas prepared us very well for the different areas of nursing. In 1979, I helped set up the first ICU in Pella and was the ICU manager. I also worked as house supervisor at that time. I was then asked to become co-director of nursing with Christy Dixon, a position we held for 8 years, and included managing the nursing home. I still retain my position of managing ICU. I spent around 26 years in managing different departments, including med-surg, ED, and OB. And throughout that time, I still continue to manage ICU. Okay, when I graduated from Pella Christian High School in 1963, there were 3 main career pathways for women. You could be a secretary, you could be a teacher, you could be a nurse. I could not type very well. I did not want to be a teacher, so I decided to become a nurse. It's one of the ironies of my career that I am now teaching nursing. What I enjoy most about being a nurse is the opportunity to make a difference in someone's life every day, whether it be a patient's family, friends, or co-workers' lives. Nurses are there for the best and the worst moments of people's lives, and what we do at those times especially can make a huge difference in their lives. The reason I work in education is that my first husband, Keith Vande Krol, was diagnosed with a brain tumor in 1998. In 2005, when his condition deteriorated, I needed to reduce my responsibility at the hospital. I was offered a position in the education department and accepted it. We are fortunate to have an administration that believes that you cannot give excellent patient service without having well-trained and educated staff. I love the variety of teaching that we are privileged to do. I teach a wide variety of subjects, ranging from teaching physicians and nurses how to resuscitate adults and children when we teach advanced cardiac life support and when we teach pediatric advanced life support. But I am also able to teach nursing assistants how to give baths and make beds. So I go the whole range of teaching. I chose to practice at Pella Regional because, first of all, I grew up in Pella. And after I graduated from high school, I left Pella and attended Calvin College and graduated from Blodgett School of Nursing in Grand Rapids, Michigan. I loved Grand Rapids. I loved Holland, Michigan. I fully intended to stay there in Grand Rapids and continue to work at Blodgett. There is a saying, if you want to hear God laugh, tell him your plans. A young man by the name of Keith Vande Krol convinced me to come back to Pella and marry him. I wanted to work in our hometown hospital. Over the years, I have worked in multiple and various places at Pella Regional. One of the areas that I have been the most passionate about is being able to influence the area of critical care at Pella Regional. Critical care not only happens in ICU, but also in the emergency department, in surgery, and on the medical surgical units. When our first ICU was built in 1979, I was asked to be the manager of the ICU, and my responsibilities included not only managing the ICU, but also educating staff to work in the ICU. At that time, I started teaching what we call the coronary care class in order to teach nurses how to read cardiac monitors and also how to take care of the critically ill patients. I continue to teach these classes to this day. The hospital also arranged for me to observe a day a month on the 9th floor cardiac care unit at Mercy Hospital in Des Moines. And as a side note, I was there when Dr. Iannone selected his first patient to have coronary artery bypass. This was a groundbreaking procedure. At that time, only Mercy and a hospital in Seattle, Washington were performing these procedures. I also started teaching the advanced cardiac life support, another class I continue to teach along with pediatric advanced life support and basic life support. Why I continue to work at Pella Regional is that due to the fact over the years our facility's culture has been a culture of caring and a culture of excellence. This follows our mission of Christian compassion. And I have been blessed to be part of that culture for 50 years. Other areas that I have worked in and I continue to work in are the fact that I was one of the first PIC nurses here at Palo Regional. It was in 2007. Anesthesia had done it up to that point. However, they could no longer do it because of the demands of their time in surgery, and they trained myself and another nurse to place PIC lines. I continue to place these lines, and I also train other nurses to place them. We also established a nurse residency program at Palo Regional. It was the first such program in the state of Iowa, and it still continues. The purpose of that program was to support new graduate nurses through the first year of being a registered nurse. An alarming statistic was that 40 to 60% of newly graduated nurses would leave their first job or even leave nursing altogether because they were so disillusioned. I worked with a team from Iowa City for 2 years to help up a statewide nurse residency program. At this time, my partner in education, Susan Vandermolen, continues to coordinate this program at Pella Regional. Another program that we started was called the Nurse Intern program. This program was established for nursing students in a bachelor's degree program. In the summer between their junior and senior years of schooling, they could apply to Pella Regional for a position, which was a paid position for an intern position. The intent of this program was not only to educate nursing students to the real world of nursing, but also to recruit and register nurses for Pella Regional. Susan also continues to coordinate the program. And a program I'm currently involved in helping develop is the Nursing Assistant Apprenticeship program. I'm working with a team facilitated by Terry Voss from the Governor's Office to establish an apprenticeship program for nursing assistants. The purpose of this program is to increase the number of nursing assistants available to work in healthcare facilities in this region. I am representing Pella Regional Healthcare on this team, along with Ashley Arkema from Human Resources. Other members on this team represent Wesley Life, the Pella Career Academy, Vermeer, and William Penn College. This is also an exciting project in progress. Nursing has been and continues to be an exciting profession, and I have been part of for so many years. It is constantly changing and constantly rewarding. And I have been blessed to have been, as I said, part of it for so many years. Thank you.